So tell you something about the Shafer Clinic. When I first arrived, so it's all like white, and it's all white and beautiful, and Christy is and was just texting me. I want to make sure everything was okay. And there are crystals everywhere, all kinds of beautiful crystals, and I love that very much. I have a lot of them around my office, but you can't see because I'm body blocking them. But I love them, and he has some magnificent crystals. But what's very unusual about a plastic surgeon office, Metabolic's office, is he also has these amazing cookies. He has like amazing cookies sitting right there, and like big bowls of candy. And he has like every kind of beverage you could ever want to have. It's not like coffee or anything. It's like I can get my coconut water, my Diet Snapple, whatever it is. And I've never actually been in an office like that before, where I was encouraged to eat, drink, and be merry. So today we're recording this, folks, and you can ask questions and you can talk in the chat box. And you see Kasha's name. She is a team member and of Back to the Body, and she's going to be capturing questions in case there she is again. There we go. She'll be capturing questions in case we miss them. And she'll also be posting links as we need them. And why don't we take a second, and Dr. Shafer, would you like to introduce yourself?
Sure.
And then Jamie, will you introduce yourself?
Sure. So my name is David Shafer. So I'm a board certified plastic surgeon here in New York City. And I started the Shafer Clinic about 2 years ago, right before the pandemic started. So not great timing, but incredible growth. So we actually have 5 floors right here in Midtown Manhattan. And we specialize not just in plastic surgery, but non-invasive procedures, the metabolic aesthetics with Ad Vitam, facial and skin care, our laser center. And we have a whole team of people that we've brought together to help people from the inside and the outside.
And I'm Jamie Gabel. I'm a physician assistant, and I'm the director of Ad Vitam, which is part of the Shafer Clinic. And Dr. Shafer and I have worked on this or discussed, we talked about this for a few years before we put it together and put it in play. And yes, at the same time, pretty much a year ago, we collaborated to add this to Dr. Shafer's practice. And for those people who don't know what metabolic aesthetics is a term that was really coined by Dr. Shafer, and it's actually really a perfect term because we want to also address aesthetics from the inside of the body out. So we're working on improving the metabolism and how it works. Whether you have a plastic surgery or a cosmetic procedure, it can help with maintaining your results after that procedure. Or if you don't have a procedure and you just want to work on, improving your metabolism and optimizing. Say it again. Libido and optimizing how your body functions as you age. It's really been a nice part of what's happening over here. And I think.
So I want to thank you. I'm sorry, Dr. Shafer.
Oh, I was going to say, you don't know what you're missing until you try it, because the hair commercial where they say I'm a customer too, like I'm
right.
You, and it's kind of like a kid in a candy store here, because there's so many different things for so many different people. But what I like to do is try everything out myself, and then you really see what it works, and it really works.
So I want to tell a story. So I want to personalize this for everyone here. Someone just texted me and said, "Is this just going to be about body modifications?" Which I prefer that to plastic surgery, because there's nothing plastic about what has happened here. I think that's actually an outdated term. Not that I'm trying to change your field, Dr. Shafer, find that not to be, doesn't feel right in my body. I prefer modifications. Some asked me in the very beginning, is this just going to be about plastic surgery or body modifications? And the answer is no. Let me tell you a story. Can we start like with the story? So, you know, I like to make things personal, because when I make things personal, then it opens the door and permissions other people. And some of you may have heard this story before, and some of you may not have, I don't know. So when I hit menopause, which for me was 50, and for some women, they start getting, some women can hit menopause in their 30s and have premature menopause. And many women start to have symptoms of menopause. We call it perimenopause, like anywhere. It can go on for like 8 years, you know, because God has a sense of humor and wants to really mess with you. And it's kind of like a very long adolescence where your body goes through all of these changes. But it's not just about hot flashes. And we're not prepared for it. We're told that it's going to be the end of our sex life. We're told about all these terrible things that are going to happen to you. And we're not told about the upside. And none of this is really explained thoroughly. And I think, and feel free, doctors, to explain if I'm wrong. There's just not a lot, you know, menopause just sort of hit the, you know, the top 10 pop charts, because we were dead really before we were in menopause, not so long ago. And if you were to look at what we call, in goddess terms or the tantric terms, the triple goddess, which is a triangle that some of you may be familiar with. It's maiden, mother, crone. So, excuse me, maiden, mother, crone. So according to that schedule, going back 100 years or more, maiden was like 12 or 13 years old. You were a maiden once you started to menstruate. You were ready for motherhood. And what's true, and some of you may not know this, but I was the executive director of the American Fertility Association, is that Mother Nature isn't a feminist. And she would prefer you to have your babies 15, 16, 17, 18 years old, like when your eggs are really, really young. And when I did this huge study of fertility, we saw that fertility declined at age 27. 27. Like, my kids just barely moved out of the house by the time they were 27. But Mother Nature, in all her wisdom, you know, is on a different time schedule than we are now. So now we have a very different timeline between our biological lives and our sociological lives. They're very different. So if I was to use maiden, mother, crone from the old days, at 50, I would be considered a crone. Now, my mother is 95, so if I'm lucky enough to live as long as my mother, I would be a crone for 50 years. That's like more than half my life would be the what we might consider the wizened older woman, you know. And we picture that really as a wizened, you know, bent over, you know, the cane, you know, that's what we picture. Am I wrong? Any people with me here? That's what we picture. And I look at that and I go, whoa, 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 I'm not ready for that. I'm not ready. My sociological life is just like taking off at 50. I'm just getting my kids out of the nest. I know not everyone's had children, but the career is like underway. And I'm like coming into my glory and into what could be the hottest part sexually of my life. And, you know, yes, that's what she, Lisa's saying, that's what she remembered about her grandmother bent over and set her ways. But you're not maybe ready for that at 50 or 47. But there are hormonal changes that start to happen, just like the aging ovary. At age 27, women are wanting to have babies at 40 They're having a hard time, right? They're doing a lot of egg donation, surrogacy. We have things for them. What are we doing to support women after 40, after 50, where menopause becomes menoplay? Like, who decided pause? I didn't like vote for that. Nobody asked me if it should be menopause. I'm kind of a menosexual, menoplay, menofun, meno have a good time. And so I went on a journey, as I do. You know, guys, I'm really good at going on the journey. And 2 years ago, I found a doctor in Manhattan, not Dr. Shafer, not Jamie. And he took my blood and he did a food thing and he looked at my skin and he said, you know, if you were a fat guy from Jersey eating meatball heroes, I can help you. Because I was starting to be upset because I was growing a belly for no apparent reason. Like I was just growing a belly. And he was like, I can't help you. This is you. You're a Russian Jewish background. You're meant to hold weight. Nothing we can do for you. There's nothing even really we could do surgically. Nothing. The hormones, nothing. Maybe a little DHA because you have the DHA of an 80-year-old. Thank you, doctor, whose name I won't mention. And he said, if you want to be on a keto diet and you want to work out every day for 2 hours a day, maybe we could do something. So I left crying and I put it away. And then I started to research what else was available. And it took me 2 years to find the Shafer Clinic. And in 3 months, my life was turned around. Now, I'm going to be clear. I'm going to let the doctors talk. I just want to give you my story and then let them jump in. Is that okay with you guys? So I went for a consult with both these gentlemen and had my blood drawn, and it was decided that my body could use testosterone. And I was like, you know, what you talking about? That's a guy thing. And I'm going to let Jamie talk in a few minutes, talk about testosterone in women's bodies and in men's bodies and how it treated me. But I will tell you it was a pellet and he'll tell you about it. And he gave it to me. Yeah, maybe I should let you, Jamie, talk about why you put me on testosterone and then I'll take the story back. All right?
Sure.
And you could talk personally about my case and then put it now for other people.
Sure. So we started with blood work and we started with a good, thorough conversation about your symptoms. And from there, we decided to do bioidentical hormone replacement pellets. And so women are familiar with going to the gynecologist. They start having symptoms of menopause or perimenopause. And the typical regimen is usually a certain amount of estrogen or estradiol and some progesterone. And very often the testosterone levels are neglected in women. And women do have and need testosterone as well. And not every clinician is comfortable with that, but it's important. And it's important that if you're going to balance somebody's hormones, that you should balance all of them and not leave some of them out. And there is actually plenty of literature, a great book written by a female OBGYN, really all about testosterone in women as this neglected and secret hormone. And so you have to be careful on how much to give a woman. The idea in this or typical setting is we're not trying to change your gender, although it can be used for that as well. And so it's about finding the right balance. But testosterone is the major sex hormone. And women in general, their bodies are different and they're made to childbear. And so there it is more common for women to, the majority of women to carry more body fat and body weight. Not the majority, but it's more common. And one of the reasons is when the hormones start to drop, and testosterone drops by 50% in women by the time they're in their 40s, the ability to build muscle mass dramatically decreases, and sex drive decreases as well. And so we determined that a certain amount of testosterone would really be able to help with helping you to build some muscle mass. And in doing that too, testosterone is so important to so many other cellular functions, even cognitively. It helps to increase your body's release of serotonin, which makes you feel happier too. So, you know, by increasing your testosterone, we gave you the ability that some of the exercise that you may have previously done will actually yield better results. And some of the energy it takes to build that muscle utilizes or metabolizes your body fat. So it also helps. That's why, you know, statistically, just the regular average man who doesn't even exercise or still has more muscle mass and typically is leaner than a typical woman. And so it's a little bit of a balancing act, but we did add some testosterone in there, as well as some estradiol.
A little estrogen, because I had breast cancer in my family.
Oh, okay, we didn't put estrogen in yours. Okay.
No, you had a tiny little bit in the pellet.
Right. So we started conservatively, and that's the way I really like to start with everybody. We can always increase on the next round, but we want to minimize side effects.
So may I interject?
Yes.
So what I've heard from women when I talk about testosterone therapy, they women who've done this a few years ago said, you know, they got aggressive, they felt angry a lot. Some of them didn't have, they had a different kind of negative emotional response. Some of them talked about increased facial hair or loss of hair in their head. I'm on it now for 3 months. Hello. Yeah. So my hair is fabulous. I've not had those kinds of emotional responses. What has changed? Like, so women are on here right now, and they tried testosterone 2 or 3 years ago versus what's available now. What's the difference?
Sure. So there are different methods of delivering testosterone. There are topical creams and gels, and there are injectables, intramuscular injections. And what I use and what I prefer to use is bioidentical hormone pellets. And what that means, just to clarify, there's a lot of misconceptions on what is bioidentical. Bioidentical hormones, they are synthesized, they are made in the lab. However, when the hormone is introduced to the body, it follows the exact normal natural pathways that your own hormones follow when being broken down and being utilized. So your body recognizes it as its own hormone. So that's the key, one of the keys to maybe offsetting some of those side effects that some of the other women had. And the other is really dosing. It's kind of like being a little bit of a chef and an artist, to get a good history, listen to what these women or patients were experiencing either before menopause, in menopause, and after menopause, and take it all into consideration. In other words, if you told me you were very moody and aggressive when you were menstruating and had extremely sensitive breast tissue, and we take into account all of these symptoms so that we dose you correctly so that you don't have those aggressions or mood changes, negative mood changes. So I think it comes down to the dosing as well.
And I'm getting regular blood tests.
Yes.
I've been coming in quite often. like every month or every 6 weeks or so. And Jamie checks my blood and makes sure that everything is running. So I'm going to tell you about my experience with the testosterone, and we're going to cover some other things. We'll move it along a little. So I didn't have a low libido. Okay. I didn't. I'm now, like, for those of you watching who say, well, I don't know really if I have a low libido and I don't know if I need this. I always believe in this possibility of more. And like, what is our sexual evolution and what is possible? So I've had 3 experiences of having orgasm literally in my sleep, like extraordinary orgasm, like I'm a 15-year-old boy kind of orgasm in my sleep. I am so aroused all the time right now in a really lovely, positive way, because I believe that we take that arousal energy and we channel that into our life. And so you have these sex hormones running more through your body. What we know, the science of that, is that you have more endorphins running through your body. You feel better, you have less depression, more serotonin, happy gas, as opposed to having to take antidepressants. We also know that the feel-good chemicals there are natural painkillers, they're anti-anxiety. I'm looking over at my notes a little bit, and is actually a good sleep aid. Jamie's also been putting me on progesterone, which I take at night, which also helps me sleep, and has been balancing that. So Jill is saying that she's on a testosterone cream, and the recent blood work that she had was that it was still super low and she's fatigued. I'm not Jamie here, but I would imagine that you might do better on injectables or a pellet than the cream.
Is it okay if I jump in?
Yeah, yes. Mm-hmm.
So I've seen this a lot where I've had patients come in and they've been on topicals, and I find that they don't seem to, even if the level in the blood goes up with the topical, they don't seem to feel the same as with, let's say, the pellet insertions. It could just be the delivery system. And even though the blood level goes up, they just don't respond the same. So with the pellets, I also think we probably bring the levels up a little bit higher than with the creams. And I think the only reason is usually the clinicians that are prescribing the creams kind of follow a very standard dosing regimen. Whereas with the pellets, we really take into consideration a whole bunch of factors before creating the dose for that person. And I think it allows us to go a little bit higher without going too far. And I think the results are really, really good.
So Karen's writing that she's not feeling a lower libido as she ages, and there's a clip on the way. You know what, darling, neither did I. Okay, I went on the testosterone for other metabolic reasons, metabolism and my muscles and skin texture, lots of different reasons why I did this. And oh my God, okay, all I can tell you is my sex life, which I thought I was at 100, is like at 200 now, that it can actually get better. The second thing talk about the pellets, and then I want to go to the Ozempic, which I'm not saying right, and then I want to talk about the body modifications of things that I've been doing to make the whole package for me. So Jamie, can you talk about the pellets and how you put them in?
Sure.
And how it all works?
Sure. So if you can imagine a pellet looking just like a Tylenol tablet, it's kind of oval shaped, and we use a special instrumentation to make a really small incision. Doesn't even require a suture to close it. And that gives us a little entrance into a fatty area of the body on the upper outside of the buttock. And we use this device and we insert that pellet into the fatty tissue. And then over the next 3 to 4 months, it's being metabolized. A certain amount is being released each day. And of course, they did studies on approximately how much is metabolized each day, which allows us to test the blood in 6 weeks and then 6 weeks again, and really follow that patient, talk to them about their symptoms or resolving symptoms or improvements. And really, it helps us hone in on how to dose the patient. And so it's really, really a nice way to do this. Does that?
And it didn't hurt. You know, I was a little nervous. I had like a little bit of anxiety. You know, I had to lay on my belly and drop my little panties a little bit. And Jamie, like, you know, numbed it and was going to make a little incision in my tush and pop it in. And I was anxious. And afterwards, it was like a little dizzy. Jamie was like, just breathe, have some of that coconut water, Pamela. I mean, it was just emotional for me. I didn't feel it. The only thing, you know, to be aware of was that, you know, he wanted me to not you know, go jogging or sit on a bicycle for a few days. He wanted there not to be any scarring from the pellet. No one would know where it was. And then it just absorbs. And then there was a question about injectables. And then I'm going to get to I can't pronounce it. I always go to the other name.
Oh, Ozempic?
Yeah.
Or the other way to say it.
The body, yes, because everyone wants to know about that. And then everyone wants to know about the body modifications.
Sure.
So go with that.
So as far as the injectables, that's typically oil-based testosterone, and it's injected into the muscle once a week. And really my preference for women is to use the pellets. It's just less maintenance, and otherwise you have to inject yourself with a certain amount of estradiol once a week, a certain amount of testosterone, and then there's measuring that you have to consider. And sometimes, not on purpose, but a patient may measure it improperly. So my preference is really the pellets, especially when it comes to the women.
I'm a little bit of a pig. So when I was just with Jamie for my 4-week post-op with Dr. Shafer as well, I was like, well, like, could I have like a little booster shot of testosterone? Because I'm going into like a lot of teaching about sex over the next month, and
Sure.
I'm doing pretty good. And he was like, all right, Pamela. He gave me a little booster shot. So, and he had seen my blood work, so it was fine for me to want it. I'm just having such a good experience. My clitoris has also changed, and I want the women to know about that too.
Sure.
Yes, Dr. Shafer, I said clitoris. I did.
All right, it's okay.
My clitoris has started to grow a little, and which it's really kind of sad. Guys lose out on all this stuff. Okay, so I mean, they may get more buff with testosterone and may boost their sex life, but their penis doesn't grow. Okay, no growing penises on testosterone. But ladies, your clitoris can get a little bigger. And it's been so interesting for me because I have more surface area to play with because my clitoris is bigger. And it's also more sensitive, and it's quite exciting. And if you have a very little clit, because women have different size clits, all I can tell you is if a guy can't find my clitoris right now, there's hope. Okay, because it's like, hi, I'm Pamela's clitoris, here I am. And so it does get bigger and more interesting and more sensitive, and it's like a brand new sex toy. My clit is just like so much fun right now. Like everyone should have my clit. So you can't, I have my clit, you've got to grow your own. So it's been really amazing for me. The other part I wanted to talk about was body fat. Now, everyone knows when I'm talking about Pamela and Back to the Body, you've all seen my Zoftic body, naked in every position possible. I am not into body shaming. I'm into curves. I'm into a healthy body. And my body was going from chubby, curvy into obesity. I was becoming pre-diabetic. I wasn't becoming, I was pre-diabetic. And my belly was growing. And I looked pregnant from the side. And that was the original reason why I saw that first doctor who told me to go love myself. I'm like, I do love myself. That's why I'm here. It's because I love myself. And I went to see Jamie and he said, actually, there's something I can do to help. And I want the women who are out there struggling with dieting and struggling with belly fat. I'm talking in particular belly fat. That this is something that happens to women in menopause. It becomes harder to, let's not talk about dieting. It becomes harder to maintain your weight. Just maintain your weight. And because I'm not a huge overeater, I put down my fork and I was still gaining and I was doing various kinds of dieting programs and nothing was working. Weight Watchers wasn't working. Nothing was working for me. And I was really discouraged about it. And it didn't feel good to my body. I was going past a place where I was comfortable. And so Jamie introduced a brand new FDA approved drug to me that I have been on now for 3 months. We can talk about my results in a minute, Jamie.
Sure.
Talk about this new drug and what you're doing with it. Because it's really just like groundbreaking stuff, people.
So Pamela's talking about a drug that's actually a peptide, which, and the brand name that people are familiar with is Ozempic. And this was geared towards diabetics because it happens to help lower something called a hemoglobin A1C level. It helps their body to build more, I don't want to get too technical, but pancreatic beta cells, and those cells in the pancreas are responsible for secreting insulin. So if, what happens in this time frame of 40s, 50s, 60s is your ability to work with sugar, your ability to metabolize sugar using insulin, all of this starts to change, and it's all hormone related. And so this medication, also called semaglutide, that's the generic name for the medication.
Can you write it in the chat space?
Sure.
See the word.
I feel like I'm writing back to somebody privately.
In the main chat box.
Main chat box here. If it just goes to one person, maybe she can help me.
No, it's got to go to everyone in panelists.
Yeah, I think it's, okay, here we go. Everybody see that?
Yeah.
Hopefully. Okay, so, and this also does something with slowing gastric emptying. So it slows the stomach's emptying of food into the digestive system, which makes you feel full quicker. And makes you decide to stop eating instead of eating a larger portion. This dosage is brought up in increments. You start on a low dose for a month, and then you bring it up each month till you get to a point that's safe and effective. And you know, it's an adjunct to a weight loss program that really does help and yield some great results, and we're having great success with this. It's just one tool in what we do to address the weight concern.
Okay. You know what? It has revolutionized my life. I just be clear about it. I mean, you could be all low key about it, but this has revolutionized my life. And I really want women, you know, getting the diagnosis of pre-diabetes, which is what, I don't know what the percentages of women in menopause are going to get that diagnosis. of pre-diabetes, but I bet it's a huge percentage of women who are going to get that diagnosis. And we'll talk about that. And so I inject myself in my belly. It's really easy. It's a subcutaneous needle. And it's been real slow. I have not really done very much. I did 1 or 2 fasts, but I'm basically following Weight Watchers or nothing at all. I'm just like following my appetite, which has completely changed my relationship with food. I used to wake up in the morning and had to have breakfast. Now I wake up in the morning and I have a cup of coffee and it's like, oh my God, it's 11 o'clock, I haven't eaten yet. And I get full much faster. I'm actually, I told Jamie, I've been eating towards appetite lately, which is like, what do I want to eat? Like not how many calories are there, but what do I actually feel like eating? Because I don't eat that much of it. And I want to eat from a place of desire. And I've lost 12 or 13 pounds over the first 3 months. This is a really, really important part. My visceral body fat, which is the fat around my organs, has gone down 1 level. There's some other really good numbers about my weight. This has been super easy. Now, somebody asked about the side effects. Everybody's different. For me, my pooping is slower. Can we say poop? We said clitoris, so we can say poop. I have to really work on eating high fiber foods because that's slowing down of my intestines is also slowing down my pooping. I used to be, this is more than you ever wanted to know about Pamela Madsen, but I used to be that person that pooped after every meal. I ate, I pooped. Everybody poops. That's right, Kasia. So I stopped pooping after every meal. And so right now, Jamie is working with me with various fiber products to get me on a more regular pooping schedule. It's not been terrible. It's just that sometimes I'll miss a day or I'm more like a rabbit poop as opposed to what I've, that's right, we do. We need to talk more about poop, just like we talk about everything else. So I don't have like those satisfying poops that I used to have. And so I'm working to get back to having more satisfying pooping. And sometimes I'm a little more tired than I was before. As far as the side effects for the testosterone, personally, I told you they've only been positive. I'm horny. Like really horny a lot. Do people say horny anymore? I know that some people could have more hair growth, but I don't think the amounts that we're using for women necessarily have those kinds of side effects as using it for people who are using it for gender, changing gender and things like that, and for men. I think we are on a much lower dose. But the side effects for me, personally, have been really small and super worth it. I've heard that some people can have a little bit of nausea on this seplutrified. If I mispronounce it, I'm sorry. I haven't had nausea. Nothing. What I've had is the inability to eat ice cream. I can't do it. We go out to eat. My husband says, "Are you really done?" And I'm like, "Yeah, I'm done. I'm like really, really done." And he was like, "Well, why did you order?" I said, "Because I'm hungry, but I'm good now."
Well, we have habits, so we're used to ordering the ice cream and the dessert. So it definitely decreases the calorie intake, but also helps change our habits.
I have a whole new relationship with food. And I have to tell you that initially it was a little confusing for me. Like I didn't understand like what was in the food. I had a friend say, "Oh my God, you have to taste this pork chop." And he put a piece of pork chop in my mouth that was apparently amazing. And I went, I had to like spit it out my napkin, like, so no one would see. I literally couldn't swallow it. And I'm not wasting away to nothing. It's like 3 pounds a month is about what I'm losing, right, Jamie?
Yes.
And I've gained 2 pounds of almost 2 pounds of muscle.
I think it was, yeah, about 4 pounds a month, right?
Yeah, about 4 pounds a month, 2 pounds of muscle. I'm actually gaining muscle. And my heart is healthier and my blood sugar has dropped. And I want you to know about this stuff because people aren't talking about it. And if we're going to come back to our bodies, if we're going to feel good in our bodies, just like infertility, when we're helping women get pregnant and we were giving them all kinds of things to support them, there are things to support you now. And I would love to jump into, if I don't know if we've answered. Jamie, do you have anything more you want to say about the side effects?
Sure. I see somebody, Heidi had asked about cardiac patients. So there are a variety of different cardiac illnesses or diseases. But this has been used with patients that have cardiac illnesses. If you remember, again, it was designed for diabetics, and a lot of these diabetics have what we call a lot of comorbidities, including cardiac disease. And actually, as you start losing weight and losing fat, it's good for your heart. So really, I would say the side effects you would be concerned about are gastrointestinal related, which in the beginning may be a little bit of diarrhea or constipation or both. But again, it really comes down to having the right person prescribe this to you and dosing it correctly. If you come out of the gate too excited and start with a higher dose than you should, those side effects are more likely to affect you. If you start slowly and be patient, they're usually minimal and they usually work themselves out.
I was very impatient to start. Like I was like, it's the drug come in because there's a big run on the drug because people are finding out about it. And initially it was difficult to get the product in for me. But Jamie's been really slow. I'm on a very, very finite regime where my dosage goes up about every 4 weeks. I have not been so excited about anything being done to my body in a very long time. I'm thrilled over this, people. I mean, there were no answers for me. And if there were no answers for me, there was no answers for so many other women over 40. You know what, Kasia, could you just put links up for Jamie and Dr. Shafer? And because they can treat you also remotely or refer you on. But some of this can be done remotely. Now, I also did other things. Some of you may know, I did other things too. I went in to Shafer Clinic with this huge agenda of wanting my biological life and my sociological life to match up. And my sex kitten days are not over, folks. And I was not feeling, there were, as much as I'm into my own body acceptance, and I tell everyone, first you have to put down the mirror and learn to love your body. And that's what we teach it back to the body, and I am not going back on that. Any of this stuff, you've got to do from a place of self-love, self-cherishing, of self-celebration, of turning yourself on. And for years, and I mean for years, I tried to make peace with my neck because I had gotten the Google gobbles under here. And the Google gobbles were not turning me on. It's like I deal with my roles everywhere else and my big, wonderful ass, okay? And other changes that were going on with aging and my body. But I couldn't make peace with my neck, and nothing was going to change that. I already loved myself. I just hated my neck. And I also found, look at my eyes. Do you see eyelids, people? I had no eyelids. the upper eye, the upper lids had started to fall literally over my eyes. And I started to get these really bad bags here. And I would look in the mirror every morning and I wasn't recognizing me. And my inside wasn't matching my outside. And it was distressing to me. And I spend a lot of time in front of the camera. I know not everyone lives my life, but I'm photographed in, if you've seen my photos, in every position, doing teaching from the table, in front of groups of women at Back to the Body retreats. And I noticed that I started to say to my photographers, can you Photoshop that? Can you Photoshop that? And my photographer would say, lift your chin, Pamela, lift your chin, or look that way. And, you know, going through all these different things. So I would feel better about my images that I didn't feel were representing how I was inside. And so as I met with Jamie, I met with Dr. Shafer. And I actually went to Dr. Shafer first for my eyes. And he was really honest with me. And he said, that's not going to make you happy. What's going to make you happy is if I do your neck too. And of course he was right. And I was a little frightened of it. And I think today I am 5 weeks. Today's my 5-week anniversary. So I did my eyes. Everybody can, I'm wearing makeup today because Dr. Shafer said I could. He said, full activity, Pamela. My mother says, Dr. Shafer, does Dr. Shafer know what that means? When
I've come to learn what that means. Maybe not full activity, maybe 90%.
So my mother's on this call, Dr. Shafer, you're going to worry her. I can have full activity because I've got demos and all kinds of things happening in like 4 days. So I did it. And I want you to know that this whole thing, all of this that I've been doing, the biggest gift I've ever given myself, outside of infertility treatment, to have my children, doing in vitro. Dr. Shafer, I feel like you want to say something.
Oh, no, I'm enjoying the story.
Okay. So I wake up every morning and every day it's different because I'm healing. And Dr. Shafer told me it take about 3 months for everything to be completely not swollen, for all the healing to happen. And I can't stop looking at myself and seeing my insides match my outsides and what that has done for me and how excited I am between the hormones, between the medication that's helping with the prediabetes and the belly fat, coupled with the restoration of me. You know, they do these things called mommy makeovers. And I want a whole new, thing. Because some of us are so past mommy, or we never were mommies. And I feel like we need to call this like goddess restoration. And you know how great art is restored? And we support that, like we support the Michelangelo being restored and beautiful painting. Yes, Karen says goddess restoration. That's what you got to call it. Because I wasn't looking to change me. I have nothing, you know, again, people do all kinds of body modifications and you do that. Whatever it is you want to do, your body, your choice, except in Texas, but everywhere else, your body, your choice. I didn't want to change me. And Dr. Shafer didn't change me. I don't have a chin implant, or my nose wasn't made different. This is my mouth. I went into surgery with this mouth. I came out with this mouth. And you may want a different mouth, but I didn't. I just wanted Pamela. I just wanted to see me. And Dr. Shafer said what I would say, well, what about this? And what about this? And what about, he said, Pamela, I'm not going to turn you into like a freak show, into like a mannequin. What I'm going to do is soften things. I'm going to soften things. You know, bouquet, I don't know what you mean by that. Karen, tell me more. He said, I'm just going to soften. And I love my body, more blossoming, yes. I'm so excited to be in the world. I get on an airplane tomorrow. I bought some new clothes. I went and actually, I never wear makeup. I've never worn makeup. I do get eyelashes and lipstick and a little liner, but I never did all the things. So today I got foundation stuff to protect my skin mostly. So I'm wearing some of that, but I had so much fun. And if you can think of menopause, if you can think of your 40s, 50s, 60s, 70s as an opportunity to give yourself permission to don't waste your time. I wasted 3 years being unhappy about something that I could have changed. Now, maybe I didn't know Dr. Shafer and I would not have been as happy. And so maybe, oh, we won't say maybe, it was worth the wait. It was worth the wait, Dr. Shafer. But, and whatever it is in your life, whatever it is in your life that you've been wanting or fretting over, with your libido, whether it's your, you know, desire, whether it's your body, whether it's your orgasm, whatever it is, stop waiting. Like, really stop waiting. Get consultations, build your team, explore. Because if I could give everyone just a little bit of the happiness that I'm feeling in my body right now, if I could just be your like fairy godmother and go bippity boppity boo for you, I would do it for you. I want you to know this wasn't painful. That I went to sleep, I woke up, I spent the night. Oh, Jamie was involved too. I've been taking, tell Jamie what you've been doing to support Dr. Shafer in my healing.
I was on mute. We put Pamela on a combination of different peptides, and these were subcutaneous injections, and I think an oral one as well, right? We did the BPC oral. And not to get too scientific, but peptides are amino acids in different chains, and they're signaling molecules. And to help with Dr. Shafer's surgery, we chose peptides that would help with healing, help with wound healing and repair, tissue repair. And so it's one of the things that we do over here. We kind of work together to see these patients really as a team, to give them the best options that we know of to heal well and maximize the results of their procedure.
I even had a vitamin drip.
That's right.
And so I woke up and I had a private duty nurse next to me. I spent the night at the Shafer Clinic, and I had 2 private duty nurses who put compresses on my eyes and fed me Jello and oatmeal and yogurt, and took me to the potty. And I went home the next day. And for 2 weeks, I mostly didn't move from my couch. I was like, my job was my face, was healing my face and following all the instructions. I didn't take a Tylenol. I didn't need a Tylenol, folks, okay? I felt some tightening, some discomfort like around here, which is still going away, but is way better than it was. Sometimes I even forget about it. But that was like the major thing, was that a feeling of tightness here under my chin, over here where there's no incision, but I know the secret that under there, he did some stitching. You tightened that. You want to talk about what you did? Because I think a lot of women are interested in this part.
Yeah, what happens as we age, the muscles of the neck start to separate. So instead of holding up against your jawline, they start to fall down and they separate between them. And so we have to go through a little incision under here and we sew those muscles back together. So you can see in my neck, this muscle and mine are separated. We sew them together underneath the skin. And then the other part of the muscle, kind of like you would do in the mirror when you're looking, like I want my jawline to look like this. Underneath the skin, we're taking that muscle and we're tacking it up. So we're tacking it up on each side and making a sling that goes under your neck, and then just gently bringing the skin back. So that way you look natural. It's a different than in the olden days where they used to just cut the skin and pull you wider and wider and wider and make you look like a cartoon character. So it's a really natural way of doing it and putting the muscle back to where it is naturally. And that's why you look like yourself. You're not looking like somebody else.
So my incisions are behind my ears. So no one can see them. I have an incision under my chin, which is healing really nicely. The incisions on my eyes, you can't see at all. They
very quickly. Yeah.
It's really amazing. The best was when I was chatting with Dr. Shafer about something that was going on. And he went, "Oh my God, I did your eyes too, didn't I?"
It looks so natural, you forget, and you can't even see the incision after a couple of weeks.
Right, he did such a good job of my eyes. He forgot he did my eyes. Like, how is that, right? Yeah. And so, what I just want to say to folks is that all the technologies around all of this is light years. This is not your mother's facelift. This is not your mother's hormone therapy. This is not your mother's diet drugs. This is a whole new world of things that are available to you, and, explore them. I also wanted to let people know that we are just a little of our own little promotion. We're having a big event in LA that I'll be showing up to. So you can check out all my scars if you want to in person. I'll like touch my face. Next Friday, the 10th, we start at like 6 o'clock. Kasha, could you put the link up? We start on like 6 o'clock on Friday evening, and then you go home. This is non-residential. We have a full day Saturday and Sunday, and we are going to be doing all of the things that you would expect from Back to the Body, talking about consent, talking about contact, sexual context, talking about connection and intimacy and arousal and orgasm. We're going to be doing the art of adoration, where we decorate you with beautiful flowers and fruits, and we have our photographer there, and you're going to get boudoir photographs, and we're going to show you some live demos. And yes, Heidi, you're coming. I'm so excited. And there's still time to register. I think we have 3 spots left. I'll hold the early bird special for you. Come be with us. I'm bringing Court Vox. I'm bringing Cosmo Means to teach with me, and Chrissy Bemis will be there. And we have and of course, Sway, our photographer, will be there. And so much is happening. And you do need to be vaccinated, just so you know, to attend the event. And all of the Back to the Body team is vaccinated. And you may want to start with, your body. You may want to start with your embodiment, and then really listening to your body, really listening to all of you, and what do you really want? And that's the question that we'll ask you. As you're doing the Lotus Lift meditation that was featured in Oprah magazine last summer, what do you want? What's getting in your way? What do you want? Well, one more question. We start with, who am I? What do you want? And what's getting in your way? And if you can come away from that portal knowing who you are, what you truly want in your life, and moving the obstacles so you have it. I don't, some women come on talk after talk after talk, and they're still sitting in the same freaking chair they were sitting in 2 years ago, with all these stories about why they can't. I can't because I'm too fat. I can't because I'm too old. I can't because of the money. I can't because of the trip. I can't because of COVID. Now the variant can't come because there's a variant. Can't come because we're doing everything to keep people safe. And your obstacles is what's really keeping you from living your best life. And I'm very, very grateful to Dr. David Shafer, his vision to put so many experts, there are so many experts there under one roof. We've only started to talk about some of the things that are being offered there. Jamie, who said, yes, Pamela, actually, it was kind of like, yes, Virginia, there is a Santa Claus, is that right? Or am I dating myself? That's how I feel. I felt like somebody said to me, yes, there is a Santa Claus and we can help you. And we will move the obstacles for you. And we will center you. And we'll give you attention, which is what Back to the Body is all about, is giving women time and attention and care and being seen and listened to. And I got that. And I'm getting that. And I want you to get that. And I want you to move your obstacles. And I want you to feel as happy and turned on and aroused and excited about life as I feel right now. And it's possible. And you can book a consultation on the phone through Zoom with these doctors. If you're not in state, let me tell you, I'd fly in. I have women fly to Tuscany to be with me, Iceland to be with me, all over the world. You fly. I'm not coming to everyone's hometown. My retreats are not in your hometown. You have to fly to be with me. You have to travel. Well, you know what? For the good stuff, you got to move your ass. So I'm inviting you guys to take advantage of this, get a consultation, maybe come next weekend if you're in the LA area, or get on a plane and join us for the portal, learn more about your body, and meet Dr. David Shafer and Jamie Gabel and see what is actually available now. Cutting edge technology was not there. It wasn't there. It's there now. And take advantage of it. Anything more you guys want to say to these people? Because we are closing. It is coming to the hour.
I think how you said you're glad you did it. I think one of the most common comments that people say when they come for their post-op visit is, why didn't I do this 5 years ago or 10 years ago?
Yeah.
So if you're on the fence, like you're saying, go ahead and do it, because you're treating yourself.
Exactly. So you'll be getting some follow-up emails. We only share the list with Gabel and David Shafer. So they'll be in contact with you, offer of, I hope, a consultation. You also can have a consultation with my team at Back to the Body about what's going on with us and how we can help you bring you back to your body, so that you're ready to do this stuff. You two gentlemen have been so pivotal in my life right now. I can't thank you enough. And I feel so blessed to have met you. And my insides match the outsides. My body feels healthy. And damn, I look good.
Oh, the feeling's mutual, and your energy is contagious. So we're very happy you're in our lives too.
Absolutely.
Thank you. So good night, folks. Be in touch with us. Call the teams. Take advantage of these opportunities. Share it with your friends. Who am I? What do you want? What's getting in the way? move the obstacle. Don't say our no for us. Don't say that we won't help you. Don't say that you can't afford it. Don't say any of those things that you're telling yourself. Let everyone work with you. Let us figure it out with you. These are good people. So listen, for those of you who are celebrating, Happy New Year. And I hope that this lights a fire. Thank you, Dr. Shafer. Thank you, Jamie.
Thank you.
Thank you.
I'll be sending pictures.
Great.
All right. Good night, everyone.
Good night. Bye-bye.
Thank you. Good night.